Hello, everybody, and welcome to this second of a series of 3 webinars organized by the MS Society of Canada. Actually, our series of webinars will be about MS and COVID-19, and several experts will take part in this series. Thank you for joining us today. My name is Martine Dufour. I'm the Director of Programming of Government Relations at the Quebec section of the MS Society of Multiple Sclerosis. It's a pleasure for me to moderate this webinar for you. Before we start, please note that this webinar is being recorded and can be viewed subsequently. You will receive next week an email with all the links to the different recordings of all 3 webinars in the series. The names of all participants will remain confidential and no personal information will appear in these recordings. If you have questions during the presentation, please enter them in the chat box which appears on the screen. Any questions that will be submitted in the moderator can be submitted in any of the 2 official languages, and we'll try to send them to the presenters today in the right order. We will also attempt to answer all questions, as many questions as possible at least. However, we would just like to advise you that we will certainly not be able to answer all the questions today, and we will attempt to find another way to answer any questions that have not been answered today. And we will not be able to accept questions of a personal nature. We ask you in those cases to refer to your care team. We're currently going through an unprecedented situation. The MS Society of Canada is monitoring closely the information provided by the Canadian Public Health Agency and other public authorities in health. The health of our community members is extremely important for us, and our ultimate priority in this period where our concerns raised by the COVID-19 epidemic are so numerous. It's important for us at the MS Society of Canada that you can take good care of yourself and your health by having the most reliable and up-to-date information as possible. Therefore, our organization has created a web page totally dedicated to COVID-19, which I invite you to consult. Now, I would like to welcome our specialists who will take part in the webinar today. Judith Brouillette and Nathalie Caron. They will give the presentation together. Judith Brouillette is a clinical nurse consultant in urology at the Jewish General Hospital in Montreal. She has been exercising her trade for 32 years, providing care with MS people for 5 or 9 years now. Nathalie Caron works as a clinical nurse specialist at the St. Jerome Regional Hospital and works within the MS and ALS clinic for now 12 years. In the last few years, I had the privilege of collaborating with these 2 professionals as part of various projects, and I'm very happy to have them with us today. Ladies, you have the floor. Can you see my presentation? Hello, my name is Judith Brouillette. As I was already introduced, let's move on to the next slide. We were asked to prepare a presentation about COVID-19. So Nathalie and I will try to comply concerning the functioning of clinics and how to communicate during the pandemic, what's happening in the clinics and so on for MS. In the specialized MS clinics during the pandemic, I can tell you now that here at the Jewish, we have neurologists that are available for telephone consultations. They all do telephone consultations, by the way. There is one present neurologist always here attending at the hospital at all times. Follow-up meetings are conducted by phone and emergencies are handled remotely. When an attack happens, it can be treated with a prescription, or very often we will coordinate with the CLSCs to send a prescription, Decadron, prednisone, whatever. And patients don't necessarily have to come to the clinic. Instead, in except in certain exceptional cases where the attacks have to be validated through a neurological exam to make sure that we won't give cortisone or steroids for nothing, and also to encourage immunosuppression so as not to create unnecessary immunosuppression. Prescriptions will always get renewed by fax or email, and that's how I work with the neurologist here, and Nathalie does the same, and all the other clinics do mostly the same. As for the specialized MS clinics during the pandemic, we nurses are always available during the day. I'm at the hospital. I work 4 days. Nathalie works 5 days per week. We can also answer the phone just as before. I also answer my emails. I think Nathalie does the same. So it's the same, it operates the same way as before, except that we don't have a neurologist present at all times. Nurses are still the link between patients, neurologists, and private care programs, even more so now because of the pandemic. We're not all present at the clinic. The requests for reimbursement are always handled with the cooperation of neurologists, and they're still handled. And requests related to home care and rehabilitation care are still being handled. We do referrals to the CLSCs and to the rehabilitation centers. That continues. Next slide, please. Now, just to give you a little overview of the communications, I put here a list of support lines for specific treatments. All those are all the support lines we have for all the treatments for MS. Serrano, Teva Neuroscience, all these pharmaceutical companies all have their separate lines with nurses that can answer your questions sometimes. And we also work in cooperation with those nurses in those pharmaceutical companies. So that's another safety net for you if ever you can't reach the nurse or the neurologist. There's always those pharmaceutical support lines that could be useful during the pandemic. And if you look on the web, there's a lot of information about the COVID and MS and all kinds of topics. When you do a search for information on the web, it's always important to check the source and the authors, those who created that web page. Consult, please, the sites created by reputable organizations like universities and governments, and check the quality of the information. That's always important. Also check the site's purpose. What's the objective of this site? Is it to inform or to sell products or services? Check also the references. It's always important to check that when you consult a website. Find out if the source is cited by other authors too. That gives you good references and you know who you're dealing with. And finally, check when this site was updated. And I gave you a list of some useful websites where you can find information. It completes pretty much that slide. Next slide, please. So here, Nathalie Caron here. COVID-19, what are the precautions and recommendations for everyone about COVID-19? COVID-19 is an infectious disease caused by a novel coronavirus that has never been previously identified in humans before. It's the 7th strain of coronavirus known in the world. The known virus transmission to date happens mostly via droplets emitted when an infected person coughs or sneezes or by contact with a contaminated surface. Interesting anecdote. I have a new study that was just published. Radio Canada spoke about a new study which is taking place at the Western University with Dr. Eric Castarabri in London, which he is doing a collaboration with the Sandy Brook Center in Toronto. What he's telling us is that droplets can cross a distance of 2 meters in 3 seconds, and these droplets can travel beyond that 2-meter zone. So following a sneezing or cough, the droplets remain in suspension in a cloud for a period of 3 minutes. I wanted to specify that because I had read previously that it could survive only for an hour, but that's still to be validated about the time it stays in the air. Because what is said here is that it could stay in suspension for 3 days. The main transmission pathways from person to person. The people at most risk are mainly those who have other diseases, comorbidities, such as chronic heart or lung disease, pulmonary diseases, including asthma, COPD. We're not talking about sleep apnea, though. Diabetes also, and high blood pressure. Cancer or an immune deficiency are also risk factors. Causes of increased vulnerability are smoking, poverty, homelessness, and malnutrition. Symptoms generally develop within 5 to 7 days following infection and can last from 2 to 12 days. So to cover that period as well as possible, we suggest people remain in isolation for 14 days after they think they have been in contact with the virus. Now, symptoms, precursing symptoms of the disease are cough, fever, extreme fatigue, decreased sense of smell or taste. That can happen, not necessarily, that could happen. And there can also be some impaired consciousness factors. The serious symptoms are difficulty breathing and pneumonia. What can we do to protect ourselves and other people? Well, cover your mouth, cough into your elbow. Those are the main precautions to be taken. It reduces droplet spreading. That's why the masks are really used for in public environments, because if we think about Dr. Fabry's study in Ontario, apparently the mask could protect people because sometimes you can be a bearer of the virus without knowing it. So that reduces contamination. Wash your hands, plus. Stay 2 meters away from other people, and it could even be 3 or 4. To be even more cautious, stay home as much as possible and avoid gatherings and public transit and adapted transit. I put on this slide the table for contamination. It's just before that, so back one slide, please. I found this was an interesting thing to show because that's the time that the COVID virus can stay or to contaminate surfaces. You see that on plastic, it can stay up to 5 days, on paper, 4 to 5 days, on glass, 4 days, on wood, 4 days, steel, 48 hours, stainless steel, and surgical gloves, the virus can stay up to 8 hours, and aluminum, it stays there for 2 to 8 hours. Those links here are for everybody, general links, precautions to be taken. The government of Quebec has created a self-care guide, which you can find online. And also there is an information line, a phone number, a toll-free phone number. Online, I don't see the exact reference. It's www.quebec.ca. There's also a website by Health Canada, which is called Know the Difference Between Self-Monitoring, Self-Isolation, and Isolation for COVID-19. There's a telephone information line, and you can also go online to www.canada.ca. Next slide. Okay, it's my turn. Judith here. I will give you a summary of MS during the COVID-19 pandemic. What happens? What are the interactions between multiple sclerosis and the COVID-19 infection? The definition of multiple sclerosis tells us that MS is an autoimmune disease that attacks the central nervous system. Everybody knows that. It creates inflammatory reactions that affects the myelin sheath and leads to the deterioration of the substance and leads to neurological symptoms. Everybody, of course, is aware of that. So we end up with attacks, or pseudo-attacks, pseudo-exacerbations, and symptoms that are cumulative over time. And some of you might have other concomitant diseases, other health problems, in other words, that can affect your general health. If we look at what is being done generally to treat attacks, when people have this general diagnostic picture, we treat attacks very often with immunosuppressants like salmeterol, prednisone, or decadron. Those are corticosteroids, and what they do generally, their general effect as immunosuppressants is that it puts your immune system on hold. It suppresses the effect of the immune system, so it creates an immunosuppression, meaning that the immune system will be less resistant to infections or any attacks that can receive during those treatments. So that, I put them in yellow. I tried to highlight them. I was criticized by saying it doesn't look very good, but it's just to raise your awareness about what is immunosuppression and which drugs are given for the treatment of attacks. It gives you an idea of those things that suppress your immune system. Treatment of pseudo exacerbations generally can be provoked by stress or an infection. If people have COVID, often they will also have MS symptoms that might be exacerbated. This is very possible because there is fever, and pseudo exacerbations can be triggered by fever or change in body temperature. Very often, what we do in the clinic when you have pseudo attacks like this, we don't treat them. We tell the patients get some rest, and we hope it's going to become better, and we will check again when the infection is over. So if ever some of you have COVID, this is probably what will happen. They won't give you any salmeterol, prednisone, and especially not any immunosuppressants to aggravate the situation. There's also the treatment of the cumulative symptoms. That continues. There's no problem unless there are drugs that come in conflict with any treatments that might be discovered for COVID-19 if ever people have COVID-19. Then there are preventive treatments to prevent attack progression and the formation of new brain lesions. Those are the preventative treatments that most people are taking, with cortisone, Clemus, Centrodol, and so on. Very often, Nathalie put the table later on, some of those treatments are immunomodulators. Generally, those immunomodulating treatments don't create any problems during the COVID-19 pandemic. You can continue to take them. And some drugs are immunosuppressing drugs, Krivis, Lemtrada, for example. Some drugs might you have to delay the start of the treatment before giving them again. Nathalie has given a table later on, which we will present to you later. There's also the treatment of concomitant diseases, comorbidities. This all depends on which disease people have to deal with and any interactions that may occur with treatments that may be given, because currently there is no treatment we give for COVID-19. There are few drugs that are currently on trial, like chloroquine and other antiviral agents and other antibiotics. Erythromycin, for example, they're trying anything they can right now, but generally there is no official specific treatment for COVID-19 infections. Next slide, please. Precautions to be taken during the pandemic. If ever people want to know what are the specific precautions to be taken during the pandemic. First of all, you have to be very careful about immunosuppressant treatments. As I said earlier, treatment of attacks should be done with a validation by care people. Very often neurologists will require a neurological examination to make sure that this is actually an attack that has to be treated as a priority with an immunosuppressant, because we want to avoid prescribing immunosuppressant treatments during the pandemic, which would put people more at risk for their immune system. And we also have to look at the degree of MS damage or disability. We look at the exposure to the virus in the community. We look at what is the general situation. People who are still working, we look at the exposure of people within the family or at work. Very often we look at how much people are exposed to other people when they work. If they can stay 6 feet away from all other people, what type of work are they doing? Are they exposed to other people? We also look at exposure during outings for shopping, because those are mostly the outings we do right now. But if I can give you an advice, maybe delegate someone who doesn't have MS or doesn't have any autoimmune disease or any other disease that could make them vulnerable and susceptible. So delegate the grocery shopping to those people as much as possible. and comply with all the instructions given to avoid infection. Also, the presence of concomitant diseases, comorbidities, people who have chronic heart disease, chronic lung disease, cancer, or diabetes. If people have those comorbidities, they should be extra careful. Those are the people who are the most vulnerable right now if they catch COVID-19. They are at risk of having more complications. I gave you here a table with all the general advice because there's no vaccine or treatment for COVID-19, as I said. So all the precautions that are to be taken, those are necessary. Let me repeat them because I know those things are repeated every day. Avoid contact. Keep 2 meters or 6 feet away from other people. Not the members of your family, those who stay with you, but other people. Avoid having visitors at home, people who are not confined. That is strictly to be applied. Avoid touching your eyes, face, and mouth. Avoid handshakes, kissing and hugging. And if a family member has symptoms, do not share glassware, dishes, or cutlery. Disinfect the bathroom after each use. To the extent possible, isolate the person in one room and wear a mask in his or her presence. Anything that to avoid anything that comes out of the mouth. And when people sneeze, they carry the infection. Hand washing is also very important with soap because COVID has little things sticking around its crown, and those little things are destroyed by soap. And those little things that stick out, those are the ways the virus sticks to the cells in the lungs, and that's where it creates inflammation and infection. So washing your hands is very important. Use Purell if you manage to find some. They're hard to find, and mostly only in hospitals right now. Cough into your elbow, spit or sneeze into a paper, and please throw the paper tissue in the garbage afterward. That's very important. Opt for telework as much as possible and stay at home as much as possible. If you must go to work, have your neurologist assess your risk of exposure. Very often it's a case-by-case approach. We did send people home with letters to make sure that they would be paid by private insurance or by their wage insurance scheme. Make sure that you make your workplace evaluated to find out whether you're exposed or not. And if you're at work, clean all plastic and metal surfaces and hard objects that may be handled. What I do when I come here to work, I have my office. We have wipes with alcohol on them. I clean everything before starting. The door handle, I have a photocopying machine. I clean everything that can be touched. I do this regularly, and washing your hands regularly. Those are the general precautions and instructions to be complied with COVID, which is a very contagious infection. And what I would like to say is that this virus is easily transmitted, and it went around the world in only 3 months. So it's pretty fast. Now, what about the relationship between COVID-19 and MS treatments? There's been many recommendations coming from many sources, several guidelines, and that was a big challenge for us. You have to know that the principles have always remained the same. The risk for our patients to be in contact with the virus has always been present. Viruses have always been there, but we noticed that COVID-19 is very virulent and its complications are more severe with people having a comorbidity. That is a new virus, which we didn't know clearly its mode of transmission at the beginning. So as soon as the pandemic was announced, the whole community, the whole MS community got into a state of alert to take measures to protect people with MS and those who are receiving treatment or who are under treatment. There are two types of treatments mainly, which are the immunomodulators. Their goal is to reestablish the balance between Th1 and Th2 and modulate the effects of Th1 and Th2, the inflammatory elements and the anti-inflammatory parts of your body. Another type of treatment is immunosuppressing treatments that act through sequestration, reduction, or destruction of lymphocytes. So the mode of action and the duration of those treatments has to be taken into consideration by the care teams. Our main concerns, particularly for immunosuppressant treatments, are as follows. We don't want to weaken the immune response in case of a contamination, because we know that complications could be more severe if people get contaminated with a weakened immune response. Next slide, please. I try here to prepare a little table to explain the whole thing at one glance so that you can see the comparisons. I put things together to give a guideline of what to be done depending on the drug you're on. The risks are always evaluated to be evaluated individually depending on the care team. You have to remember that at all times, if there's a presence of symptoms, flu-like symptoms or fever, or in case of hospitalization, the administration of the treatments mentioned below may be reconsidered. At all times, if you have symptoms, and if you are under treatment, or if you get a positive COVID result, you should notify the MS clinic or the attending neurologist. Of course, putting into place or initiating a new treatment at this time is really to be evaluated closely to take care of patients' safety. We consider the severity of the disease, specific factors to each person, how the clinic works and operates, and risks and benefits. There are risks related to MS if it's not treated, but there's also risks related to treatment that is being used. So it's always a case-by-case approach, and we have to take care of the patient's safety. In the risk-free drugs, we consider that we have Copaxone, Glitect, Avonex, Plegridy, Rebif, Extavia, Betaseron. Those are safe drugs that you can continue without any risk. And those are in the category of immunomodulator drugs. Low risk are Tecfidera and Albagio. Those drugs generally create no problem. You just have to make sure that you have enough lymphocytes. You have to make sure that there's no lymphopenia, because particularly for Tecfidera, we know that for some patients, it decreases the number of white cells. We do clinical controls, and we take care of that situation by doing blood tests and lab tests regularly to make sure there's not a big decrease of lymphocytes. And if your neurologist considers that you can continue the treatment, it means that it's safe. So those are not drugs that we would stop easily. Drugs that have a risk-benefit analysis to be done are Gilenya and Figolimod. You have to check. Those are not drugs that have to be stopped, though. And we consider that the risk is very unlikely, but we know that if we had to stop Gilenya or Tysabri, the risk of a rebound of the disease. This is something we want to avoid. So those are drugs that we consider as being safe and to be continued more than the risks that they could cause, and giving an opening to the infections or attacks. The treatments that are if they're underway, we consider that maybe we could consider delaying those treatments. Those problematic treatments are Limtrada, Mavenclad, and Ocrevus, and Rituxan. The decisions about stopping a treatment have to come from your neurologists, and decisions have to be made by your clinic. We know that there are treatments cannot finish because you've taken them for 6 months or 1 year. There is a lifetime for each treatment. Some drugs can stay longer in the system. So some neurologists know that delaying a treatment, postponing some treatments such as Ocrevus or Mavenclad, that remains pretty safe at this point, because we know that the life cycle of those treatments goes longer than the general intervals. That belongs to the treating neurologist. There might be some decisions to continue treatments of Ocrevus at some clinics, depending. All taken together, we always remain in a safe zone, and because we know very well the mode of action of those drugs. As for Limtrada, this is a drug which acts a lot on immunosuppression. Lymphocytes are reduced a lot with Limtrada specifically and Marie-Claude. We can clearly see that decrease in white cells and lymphocytes, and then we can inform you whether it's safe for you to continue the treatment or not, to expose yourself to a risk that would be increased, that would require more strict isolation to protect you. So the fact that those lymphocytes are low could expose you to viral infections more easily. Not necessarily that you would catch COVID more easily, but your immune response might be inadequate if ever you catch the virus, and it would act more severely than other people that would not have been exposed to those type of immune treatments. If those treatments, if your lymphocytes are back to normal with those treatments, if you're finished with this drug for a year or 2 years, there's no risk at this point for you to start the treatment, provided the lymphopenia is resolved. Another thing, some drugs, some MS drugs, have antiviral properties, and interferons, for example, have that antiviral properties, such as Tecfidera and Aubagio. It's interesting to know also that currently that fingolimod is being studied as a treatment for COVID-19. So it could be one interesting thing to know and encourage you to motivate you to continue with your fingolimod treatment. Next. We had questions regarding vaccination, immunization. Just a little reminder, what is the purpose of vaccination? The purpose of vaccination is to strengthen our immune system and to allow the body to protect itself against certain diseases. The mechanism of action is when the vaccine is introduced into the body, it triggers the production of antibodies, as if the person had been exposed to the disease. There are memory cells that record this introduction and prevent reinfection if they encounter the disease again, or reduce the possibility of reinfection. Why do we vaccinate patients? Why should we vaccinate before starting an immunosuppressant treatment in people with MS? Well, in case of lymphopenia, very often the consequence of certain immunosuppressing treatments creates lymphopenia. Then the immune response to the vaccine would be reduced, so the vaccine would be less effective, and the production of antibodies may also be reduced or even non-existent if the vaccine has not been given before the start of the treatment. So it's not indicated to have a vaccine when you're immunosuppressed. You can have an immunosuppressant, though, if it doesn't create any severe lymphopenia, and then we can expect a good immune response, even if you're under treatment. But that has to be checked on a case-by-case basis. You need to have an adequate level of lymphocytes before being vaccinated. And if ever there was a vaccine against COVID-19, of course, it would be indicated for our MS patients. Don't hesitate if there's a vaccine against COVID-19. It protects patients and it prevents cascades. When you're in contact with a virus, the system tries to defend itself and increases the number of lymphocytes. And that's not what we want to do with MS, this deregulation of lymphocytes. We often treat MS by reducing lymphocytes. So the vaccine is important, yes, but always bear in mind that there is immunosuppression. Is it a living vaccine? And there are delays to be complied with after receiving a vaccine or before starting a new treatment when you had a vaccine. All this has to be discussed individually with your care team. Next slide, please. That's my turn. We prepared for you a stress management slide, how to manage your stress during the COVID-19 pandemic, because stress is very high during the pandemic. It leads to situational anxiety. It means that this is anxiety caused by the situation, which is very normal. It's a general situation. The suggestions for managing stress and anxiety during confinement, there are several possible suggestions. It could be to wrap yourself in a gravity blanket, a weighted therapeutic blanket, like a big blanket, or it could give you comfort. Take naps, drink water, or eat healthy comfort foods. People have a lot of time to cook these days. Listen to the sound of the sea in applications such as Calm, which you can get on your iPhone. Relaxing music the Calm app. Sing and breathe, get some fresh air. It's relaxing. To take a shower or bath, but not be careful about hot water, not to provoke pseudo exacerbations. Breathe in essential oils such as lemon and orange, or peppermint for migraines, lavender for is an anti-stress oil, marjoram is an anti-anxiety oil. Give yourself a massage your own feet, read a good book, try meditation, mindfulness, yoga. Take a break from social media and news, especially these days. You see only that on television, so take a break from it. It could be good to reduce stress. Organize a daily routine of activities, exercise, naps, reading, and sleep. Please sleep enough. You remain with self-discipline, please, during these days of confinement. Learn something new, a new language, learn how to knit, painting, crafts, whatever you can do, cooking, gardening. I started myself personally yesterday. Now we have access to a gardening center. It could be an interesting activity since the nice weather is coming. Make a list of positive things in your life. It could be an anxiety-reducing activity. Jeannette Bertrand suggested to write anecdotes, life events. That could be interesting too. Do crosswords or Sudoku. That helps memory too. It keeps you alert. It's cognitively beneficial. Clean house. It could be a liberating feeling. Move for at least 30 minutes a day. Exercise. It helps overcome anxiety. Focus on the present. Rationalize. Remain sensible. Keep a diary during confinement. All those are all suggestions that I noted in the guide, which is in the references later on. It's a guide that was prepared by one of the nurses. His name is Gérard Lebel. He's a psychologist too. He's one of my former colleagues, Gérard Lebel. I put the reference. He prepared an excellent guide on how to manage stress and anxiety. He works at the Douglas Hospital. So there's all kinds of tools that you can use in this guide. It's very well done by Gérard Lebel, and it's my plug. Next slide, please. What should we remember from all that? We'll try to accentuate the positive. Try to do the same. We know that 80% of infected people get better without any specific treatment. So it's a good thing to know that they won't have too many symptoms. They will be positive and they will get out of it very well. The pandemic is leading to worldwide research efforts and an international determination to find treatments and a vaccine that will make it possible to control or prevent the disease and other epidemics in the future. So coronaviruses have been in existence for a long time. Some studies were already ongoing. Maybe some studies stagnated or slowed down, and they were not considered as important. But I think now that a lot of effort will be put to find out how to find vaccines and so on. The advancement of research in the field of immunology may well contribute to the advancement of MS research, because we're leading with an immune system disease. And the disease is not something that suppresses your immunity, but it modulates your immunity. And the treatments modulate also your immunity mostly. So that will certainly be useful for us as research when we come out of it. The situation will also allow us clinicians the possibility to experiment with new ways of assessing patients. That will allow us also to update tools that will enable us to do that remote type of monitoring of patients. And now there's some transparency that has developed with our patients by demonstrating a lot of availability, especially for reassurance, to reassure people and to provide information. So this situation helps in a way. It develops closer links with patients because there are a lot of concerns. So it changes a lot the dynamics. The future guidelines about immunosuppressant treatments might change. They may become more precise. We think that maybe in the future that in addition to being more precise, it might also lead to a consensus in practice, something very clear about what is to be done in practice. Although we always have to favor a case-by-case approach, of course, depending on the circumstances. But there might be clearer guidelines. Regarding pharmaceuticals, I found it interesting to raise the fact that all companies are working with a common goal now, to find treatments and vaccines. And it is something to be wished for. We can hope that this will make it possible to improve cooperation in this industry and decrease the excessive competition in future with the sole shared aim of protecting the public. So that's positive. Another positive point for society is improved hygiene measures, better knowledge of the precautions to be taken to prevent infections in future. That's a guideline which we will have to continue implementing, and that will be unceasing because we will always be exposed to new viruses, and I think now people will be on the listen and will be better informed about that. And it gives a break to the environment and less pollution. We hear a lot about those positive aspects of the epidemic. Apparently, we see things from space which we didn't see before, and that's an interesting point. A break for the planet. And social ties, family ties, and social ties. And as I said with our patients, it brings people closer together, and it will change the way we are in future and our relations with our peers clinically. So those were the positive points to be derived. One last slide here about useful links about MS. Maybe you can go and browse and navigate and all that. There's a Multiple Sclerosis Society of Canada, and some apps are very useful. And they have developed information about COVID. There's the Abby app, but what drew my attention especially is MSology. I would like to draw your attention on the fact that you have the address here if you want to connect, but right now there is a questionnaire directly for people with MS on MSology, and that evaluates how you're coping with this pandemic now. What are your concerns in relation with your disease, but also in relation with your treatments? So there'll be data and statistics will come out of that survey that will probably be very useful for us in a clinical setting. So that's it. I would like to speak a little bit about the table at the end now. Yes, those are my references here. Next slide, the table. Just this morning, I got a call from a patient who was very worried that they would suspect Ocrevus. I have some reservations, as I said to her. Currently, what they're recommending is to delay Ocrevus a bit until the end of the pandemic, at least a couple of months before you receive that treatment, since those are immunosuppressing treatments. I thought I would put this table here. She was asking me, what are the symptoms of COVID? I gave you a table here to differentiate a cold from a flu from COVID-19. That could be a bit confusing sometimes. So COVID-19 has an incubation period, which is pretty long, 2 to 14 days. Symptom onset is gradual, not like a flu. So you have to know that. You have to be aware. It's not as fast and sudden as the flu. The duration is pretty indeterminate right now. What we know is that people can have symptoms and be contagious between 2 to 14 days when they're incubating, and after that they can have further symptoms, and the total duration of the disease could be up to 20 days. And recovery for those who are really, really sick and intubated and so on could be very long. It could take months. So the symptoms which we note in people with COVID that are very frequent are sore throat. They'll have a cough or chest pain, difficulties to breathe, and oppression, and strong fevers above 38, strong fever, high fever. So for older people, it could sometimes be just 37.9 or 37.8. That could be considered as high fever for older people. High fever, and also a lot of breathing and respiratory issues. There can also be all kinds of other symptoms such as runny noses, fatigue and weakness, but the most frequent are respiratory issues. And what is very frequent is a loss of smell, a loss of the sense of smell and taste. When people have COVID-19, that is one symptom which is preliminary, apparently, before you actually develop other symptoms. Also, people after and sometimes during the infection, what some people reported is that they had neurological symptoms and loss of sensitivity in their fingertips. Those are symptoms that we have to be aware of. If ever you have symptoms like that, you will be able to make the difference between a cold, the flu, and a COVID-19 infection. So that's the end of my presentation here. Thank you very much, Judith and Nathalie, for this presentation. And that was a good popularization. You provided a lot of information to our patients. Now we have approximately 10 minutes, I would say, for the question period. Some questions have been submitted to us at registration or during the presentation. So I will go with those questions, and any of you two ladies who is most comfortable can give the answer. Many people were asking for precisions about lymphopenia that you were talking about, Nathalie. People are wondering, first of all, what is it? And at how many, what is the threshold? It's 0.5. When can you consider the lymphopenia has been resolved? Well, the lymphocyte count, I would say that the reference values can vary from one lab to another, depending on the hospital and so on. So always refer to those reference values used by your clinic or hospital. On average, it's between 1 to 3.5 or 4 by 10 to the 9 in the calculations that were given. Lymphocyte counts are calculated following the blood sample. We did a blood formula, and lymphocytes are just a portion of the white cells. In the white cells, you have the neutrophils, the lymphocytes, and phagocytes. There are 6 or 7 different white cells that have different roles, particularly lymphocytes. So the normal values for lymphocytes generally are between 1 and 3.5. What do we consider as being lymphopenia? That can be that can depend on the place where the tests were made. Lymphopenia, severe lymphopenia, would be when the values are under 0.8 or 0.5 by 10 to the 9 cells. Normal values are between 1 and 3.5. If you're below 0.8 or below 0.5, we consider that under 1, below 1, you have lymphopenia. Below 9.5, you are below 0.5, you're in severe lymphopenia. Below 0.8, you're fragile, you're weakened. That's a medical evaluation to decide whether or not a treatment is appropriate because of that lymphopenia level. May I add something? Yes, of course. All right. What I heard in terms of guidelines for conduct in Quebec, and for Ocrevus and Gilenya, Marie-Claude and Lemtrada, when there are a lymphocyte count under 1, they would ask patients to isolate themselves. I think it's logical for patients who are below 1. They become too weak and too susceptible to infection because it's a virus which is easily transmitted. So under 1 is, that's what I would like to say. Good. Excellent. Actually, someone was asking us in the previous webinar yesterday, it was mentioned that immunosuppression could be helpful so that the immune system wouldn't get overexcited and fully operational, and it wouldn't put the second weak stage, which is the most dangerous, of overreaction by the immune system. So apparently immunosuppression could not always be a problem. Is there a consensus about this right now? Could we get some clarification about this in terms of immunosuppression? Is it useful or not? I know there's a concern that comes up very often. Well, I think, well, I don't know clearly what was said or heard, but when you're immunosuppressed, the result means that if you're exposed to a virus or bacteria or any germ or infection, our immune system doesn't respond in the same way. So we're no longer in control because we don't have the required elements to reestablish the balance. So I think that when you're immunosuppressed, you are more exposed to a risk of infection. To me, it's clear because it diminishes the immune cascade uh, because of that immunosuppression. But I can't say, I don't know quite clearly what was mentioned yesterday, so I can't refer to what was said yesterday. But I think that immunosuppression does reduce the response of our defense systems to an attack. Excellent. Then a few people were asking the following question. Can some people with MS, did they get the COVID? And if so, how did they cope? How did they get out of it afterwards? I don't know any so far personally, and I wish we won't have any. But what I can tell you though is that right now, all cases of MS which have COVID as positive are inventoried and monitored. Neurologists are informed that their patients have a positive test for COVID-19. And we're preparing a database which will be very useful in the future, but currently we have no data. Excellent. We also were asked about groceries. People are wondering, should they disinfect everything? Do this with talking about workplace elements, but simple things like lettuce or any groceries. If I can give you an answer. Of course, all groceries so far, you have to wash your hands before getting in anyway with soap. And inside the grocery, there are more people coming in, so products have been handled and touched, as we showed on the table that we put cardboard. It could stay up to 24 hours on cardboard. On plastic, the virus can stick for about 4 days on plastic. Paper too. So of course there's more risk since this is a public place. There's more chance that the materials are contaminated. What I noted, especially if someone is already immunosuppressed, someone who's already fragile with a weakened immunity system, what I do personally, I wash my hands when I go in, I place my order, and then I pay. And what do I do? In my car, I put myself some wipes, wipe cloths for babies. I wash my hands again because the virus is actually destroyed by soap. And when I come back home, they also say that you should clean the boxes with soapy water, soap and water. That's an extra precaution to be taken, especially if people have various diseases, chronic diseases. It's often suggested to do that. And so I do it personally at home, not totally, but I try to clean as much as possible the bags, the boxes, the packages to make sure that there is no contamination. Maybe I'm a bit maniacal. Someone was also asking, as a person with MS, are we considered weaker or more fragile than older people? As fragile, as vulnerable, depending. It's always a case by case approach, but it's still a chronic disease. Let's call it that way. But older people, for their lungs and for their heart and for their kidneys, there's the aging effect. And you become mortgaged, you become more affected, and you resist infections to a lesser extent. I would not put MS people with older people at the same level. Older people are weaker, but there's still MS people are so fragile. What do you think, Nathalie? I agree with you, but what's specific about MS is the, the attacks. It's not necessarily the disease as such, but there's lymphopenia. Lymphopenia is also patients that have progressive form of the disease, the fact that they're less mobile, they don't move as much, they might be more exposed to people with home care and adapted transport. All this exposes them a bit more. Although they're not under treatment, it exposes them probably more to a risk than other people who don't have MS. A couple of more questions before closing. Someone was asking how to protect yourself against these home care workers who come into your home. If you're with reduced mobility, for example, how can you protect yourselves a bit better from exposure to people who come to support us in the home? I think that we've already mentioned most precautions with Judith. Hand washing. Nobody should get in without washing their hands, and the person should go immediately to wash their hands. And I think, especially with healthcare workers who move into a home, I think that it would be interesting for those people to have a mask at the home, because since we don't always know whether you're positive or not, sometimes you don't have symptoms, in order to protect our patients, to protect other people, I think the healthcare workers should wear a mask. That would have to be advocated and encouraged, even for yourself, for the MS person. It's not to protect yourself that you wear a mask, it's to protect others. But in the current circumstances, I would also put a mask as an MS patient. If I had to receive home care, I would still put a mask on, and hand washing too. That is pretty important, depending on which type of care is provided. But really, wearing a mask for both people, for the healthcare worker and the patient. Make sure also that all material that is used is cleaned, right? I think I would validate. Sometimes we don't think about this. Those are things that we do so routinely, and I would pay more attention to what is being touched, what the person is touching me with, a stethoscope or whatever instrument, that is to be checked. But also, I suppose that people who go in a home care visit, they got some training and they get some protective material such as blouses more than masks, I suppose. They got PPE, personal protective equipment. I'm not in home care, but I suppose they started wearing those PPEs. I hope so. Last question. Could you say a word about eventual recurrence of common activities like schools? When school begins again, when you have children going to school, how can you respect social distancing and so on? Do you have any advice about that situation? Schools, I get the feeling that it's going to be difficult for children in school to distance themselves from other children and from the teachers. What I saw, like what they did in Taiwan, they created a little cubicle with each desk for the children and students, which helps a lot, and it creates some form of a barrier. It's like a cage, a little cubicle, a plexiglass cage, as they did in the grocery stores and pharmacies. Maybe that will happen in the schools too. And also, if they have children, making sure they wash their hands 20 seconds at least with soap when they come into school, washing their clothes immediately when they come back home, and make them remove their shoes also. That's pretty much what I would do. And respect the distances when you go and drive the kids home or to the daycare. It's pretty important. And at worst, I suppose at the beginning, everybody will put masks on. People will not go out without a mask after that confinement. We see masks more and more often when we go out. That's my vision of things. I don't know what you think about that, Nathalie. I think that, of course, the after epidemic has to be considered, and we'll have to trust our public health authorities and the teachings and recommendations given by public health. And whether we want it or not, we will have to resume our activities after COVID. Right now, we're in an intense period. We're at a plateau. We're experiencing this plateau together. It will move later on, and there will be other cases later on with a second wave, but everything we'll have to go through during this period will be useful also in future, and we'll have to go back to living again. The COVID, we know it because it was imposed on us, but there are other viruses that will come and all that. And at one point, we just have to know that if we take all required precautions, whatever virus, whether it's known or unknown, at least we would have done everything required to protect ourselves. So we'll have to resume our pace of living eventually and trust the recommendations we get. Thank you very much, ladies. Unfortunately, that's all the time we had for the question period. As I said at the beginning, rest assured that we will all review all the questions and we will explore various solutions to provide answers to all the questions that were asked. I would like now to take the time to thank our two speakers today. The information that you gave us will certainly be very useful to community members during the difficult period we're going through right now. I'd like to leave you on one last slide. Let me remind you that we have at the MS Society of Canada a knowledge network about MS with navigators who are there to answer your questions about MS, including any question you might have in relation with MS and COVID-19. You can communicate with them by phone, by email, or chat, as you can see on the screen. I hope it works. I can't see it myself. Our next webinar, last webinar in the series, will take place on next Wednesday on April 22nd. At that webinar, we'll receive a psychiatrist, a physiatrist, and a specialized MS nurse. The webinar will be in English with a French simultaneous interpretation service. If you wish to attend that webinar, please register from the webpage of our website and mentioning the language of your choice so as to receive the right link. If you want to listen to the webinar in English, go to the English webpage and that will give you the right registration page. Finally, as you probably suspect, the current context has forced the MS Society of Canada to change the ways of communicating with the community and mobilize that MS community. Of course, it is very important now that we should get engaged and mobilized in these difficult times. So I invite you to visit the WeChallengeSP.ca site to know more about the virtual national movement which we have launched as we get closer to the MS Awareness Month, which is the month of May, so that we can build a world without MS together. In the next hours, you will receive a short survey about today's webinar. We will be extremely thankful if you could fill this out. Please, that will help us improve all our future webinars. Once again, I thank you for taking part in today's webinar. I wish you a great end of day. Thank you, everyone. Thanks.